All right, welcome to The Explainer. Today, we're basically becoming medical detectives. We're going to tackle a mystery that honestly hides in plain sight, pretending to be just simple back pain. Let's get right into our first clue. Okay, so picture this. A young guy, totally healthy otherwise, walks in complaining about this exact thing. It's not like he pulled something playing soccer over the weekend. No, this pain is chronic. It's deep. And here's the really weird part. Moving around, exercising, actually makes it feel better. Right away, you know this is not your run-of-the-mill back sprain. These are our first clues.
And that right there, that is the huge question, isn't it? Is this just bad luck with back pain, or is there something way deeper going on? For so many people, this exact pattern gets misdiagnosed for years, and that can lead to damage you just can't undo. So our job today? We're going to follow the evidence and unmask the real culprit.
Okay, first things first. Let's open up the case file and see what we're dealing with. This is the textbook presentation that trips up even experienced professionals. That combination, that morning stiffness that gets better with activity, that should be a massive flashing red light. It tells us we're probably not looking at a muscle injury. We're looking at something systemic, something inflammatory. And getting those two mixed up, that's exactly how this condition stays hidden for years, sometimes even decades.
So if we've ruled out simple back pain, then what are we hunting for? It's time to build a profile of our prime suspect. The condition is called Ankylosing Spondylitis. So here's our guy, Ankylosing Spondylitis, or AS for short. Now, the most important word on this slide is autoimmune. What does that mean? It means your body's own immune system gets, confused. It starts attacking itself. And its main targets, the joints in your spine and your pelvis. So think of this less like a wear and tear problem and more like a case of friendly fire.
And our suspect, it turns out, has a very specific MO. The investigation really starts to narrow when you look at the victims. ASID's men about 3 times more often than women, and it usually shows up when they're young. We're talking 20s and 30s. So the patient from our first clue, he fits the profile perfectly.
And then there's this, a huge genetic clue. A whopping 90% of Caucasian patients with AS have this specific gene marker, HLA-B27. But, and this is a really big but, you have to be careful with this piece of evidence. Tons of people have this gene and live their whole lives without ever getting AS. So it's a super strong lead for our investigation, for sure, but it's not a smoking gun. It's not a confession. All right, so we've got a profile of our suspect. Now it's time to get on the ground and follow the clues. To look at the specific evidence the body leaves behind. This checklist right here, it's absolutely crucial. See, unlike that mechanical pain that screams at you when you move, this inflammatory pain actually gets better. The morning stiffness isn't just a little creakiness, it's intense, and it can last for way more than 30 minutes. And the pain, it often shows up first as this deep, nagging ache right in the buttocks, which is actually inflammation in the sacroiliac joints. These clues are the polar opposite of what most of us think of as a bad back.
And the trail doesn't stop at the spine. Nope. Because AS is a systemic disease, meaning it affects the whole body, a good detective has to look for accomplices. We're talking about things like painful inflammation in the eye, that's uveitis, gut issues like Crohn's or colitis, even skin problems like psoriasis. And down the road, it can even cause cardiovascular issues. This thing is a full-body problem.
So, we've interviewed the witnesses, the symptoms the body is giving us. Now it's time to bring in the forensic team, the heavy-duty tools. This is where we find our smoking gun, not on the surface, but deep inside the body with imaging. Okay, so we've got 2 main forensic tools, and they have very different jobs. Think of an X-ray like arriving at a crime scene days after it happened. All you can see is the aftermath, the bone damage, the fusion. The structural changes are already there. An MRI, though, an MRI is like having a live video feed of the crime in progress. It sees the active inflammation, that swelling inside the bone marrow, which is the hallmark of an AS attack happening right now. When you look at X-rays over time, they tell a pretty grim story. In the very early stages, that sacroiliac joint just looks a bit blurry, maybe a little wide. But as the immune system keeps attacking, it starts to eat away at the bone, creating these erosions that give it a look radiologists call a postage stamp edge. And eventually, the joint can fuse together completely, basically vanishing into what they call a ghost joint. Now let's move up to the spine. One of the first clues you can spot on an X-ray is something called the shiny corner sign. So imagine the front corner of one of your vertebrae. The inflammation starts eating away at it. The body, in response, tries to heal it by packing in some extra dense bone. On an X-ray, that dense patch shows up as a bright white or shiny spot. It's a classic sign of early damage and the body's attempt to repair it. Now, if the disease is left to its own devices for too long, we get to the most infamous sign of AS, the bamboo spine. What's happening here is the body starts building these little bony bridges that connect one vertebra to the next. Over time, these bridges fuse the spine solid, stealing all its flexibility until the whole thing looks, well, like a single rigid stalk of bamboo. It's as inflexible as it sounds. And there's another late-stage clue. This one you see from a front-on X-ray. It's called the dagger sign. The ligaments that run right down the middle of the spine can actually calcify. They turn to bone. And on that X-ray, it looks like a single, dense white line, like a dagger has been plunged straight down the midline of the spine.
But I really want to circle back to the most important tool in our entire detective kit, the MRI. I really can't stress this enough. The MRI is the absolute gold standard for catching this disease early. Why? Because it can see that active inflammation, that bone marrow edema we talked about, years, literally years, before an X-ray shows a single sign of permanent damage. It gives patients a fighting chance.
Okay, so the imaging is back. The evidence is undeniable. We have our diagnosis. But what happens after the verdict? What does living with a condition like this actually mean? And this is the truly cruel irony of ankylosing spondylitis. The very process that fuses the spine, making it so rigid, also makes it incredibly fragile. You end up with a spine that's as brittle as a glass rod. And that fragility can lead to some really devastating complications. A simple fall, something a healthy person would just brush off, can actually fracture the spine. The breaks are often so clean and straight that they're grimly called carrot stick fractures. You add that to the risk of the spinal canal narrowing and severe osteoporosis from all the inflammation, and you start to see why a late diagnosis is so dangerous.
So, what's the path forward? Well, it absolutely requires a team approach. Step 1, the most vital step, is getting a referral to a rheumatologist. They handle the medical side of things. Then, co-management with physical therapists and chiropractors is fantastic for keeping mobility and helping with pain. But, and listen, this is a non-negotiable, potentially life-saving rule, there should be absolutely no high-velocity, forceful adjustments over any parts of the spine that are fused or actively inflamed. Period.
And really, this is what it all boils down to. This is the main takeaway from our entire investigation today. Catching ankylosing spondylitis early and getting the diagnosis right, it isn't just about giving the problem a name. It's everything. It's the key that unlocks the right treatment to slow this disease down, to manage the pain, and most importantly, to prevent that irreversible fusion that leads to a lifetime of disability.
You know, your body is always telling a story. Every ache, every pain, it's all part of the narrative. The question is, after today, are you better equipped to read it, to understand the clues it's giving you?